Hi, welcome back to your prescription for medication education. My name is Yenmi, and today I'll be talking about parental dosage forms. I hope you've enjoyed my last couple of videos. If you do, please like and subscribe. The objectives are to review parenteral injection administration routes, discuss 5 types of pharmaceutical preparation for injections, explain some of the standards that are used for parenteral products, cover some of the solvents that are used for parenteral formulations, and differentiate between small volume parenterals and large volume parenterals. Giving medications via the parenteral route essentially means we don't involve the GI tract. So this can be done by injecting medications directly into our tissues or the circulatory system directly. This has several advantages. For medications that have poor oral absorption, this is another route that we can use. For instance, if we give a medication via the IV route, this has 100% bioavailability. Medications given via injections have a faster onset of action compared to the oral route. This is especially useful for patients who are MPO or unable to swallow. It also helps avoid the hepatic first pass effect. There are several disadvantages as well. There is pain or discomfort associated at the injection site. There is a risk for thrombus formation via when we give injections, and there is increased risk for infections as well. There are many routes that medications can be injected into, whether that's directly into an organ or areas of our body. Some of them include intrasynovial or into our cornea or intraarterial, but today I'll be focusing on 4 major routes, which is going to be the intravenous route, intramuscular, subcutaneous, and intradermal. One of the most common routes to give medications intravenously is the peripheral route. This involves either the basilic or the cephalic vein. These are upper extremity cannulation sites that are the most durable and convenient and are much less likely to have complications such as thrombophlebitis. It's important for us to remember that intravenous drugs must be in an aqueous solution. It's important because if they're not, they can precipitate, which can lead to pulmonary microcapillary occlusion and block blood flow. Medications can be either given as a single dose or as a continuous infusion. Typical fluid flow rates are somewhere between 42 and 150 milliliters per hour. One of the common risks associated with IV administration is the risk for thrombus formation or infection. This risk can be minimized if catheters are usually replaced within 72 to 96 hours. Another risk is extravasation. This is essentially where the medication leaks out of the vein and gets into the surrounding tissues. The IV administration site should be disinfected with either alcohol, chlorhexidine, or povidone iodine. The typical catheter sizes that are used for peripheral sites are somewhere between 18 to 20 gauge for adults or 22 to 24 gauge in infants and children. Another common way that medications can be administered intravenously is through the central route. Central venous catheters are inserted through either the jugular, subclavian, or femoral vein. Doctors can also place what's called a PICC line, which stands for peripherally inserted central catheter, through either the upper basilic or brachial vein. The end of the catheter tips terminate at either the inferior vena cava, superior vena cava, or the right atrium. Central lines are used to provide medications that are irritating or concentrated. For example, total peripheral nutrition and chemo requires administration through a central line. Unlike peripherally inserted catheters, these catheters are meant to stay in place for an extended period of time. Central catheters use what's called the French system to measure the diameter. For reference, a 1 millimeter diameter catheter is equal to 3 French, and unlike traditional peripheral gauges, the higher the French size, the larger the diameter. PICC lines and jugular central venous catheters are usually preferred. That's because subclavian central venous catheters have a higher risk of bleeding and normal thorax, and femoral central venous catheters have a higher risk of infection. When a medication is given intramuscularly, it's deposited into the muscle fascia. This is typically done with a needle gauge between 20 to 25. Muscle is embedded with a rich supply of blood vessels. Medications that are irritating are better tolerated if given this route instead of being given subcutaneously. Traditionally, there are 4 sites in which we administer intramuscular injections. The first being the dorsal gluteal region, which is 5 to centimeters below the iliac crest, right around the upper outer quadrant of our buttocks.
The dorsal gluteal site is no longer recommended because of its proximity to the sciatic nerve, which if damaged via injection can lead to partial or permanent leg paralysis. The preferred site of intramuscular injection is the ventral gluteal region instead. This site is safer and offers better absorption of the medication. The recommended amount of medication that should be administered in this site is 3 to 5 milliliters. The next site we typically administer intramuscular injections is the deltoid. As a pharmacist, this is where we administer vaccines, and we want to ensure we place the injection 2.5 to 5 centimeters below the acromion process, about 3 finger widths below the acromion process. This helps avoid damage to the subdeltoid bursa. The maximum amount of fluid we want to inject at once is 1 to 2 milliliters max. Finally, we have the vastus lateralis. This is the anterior lateral aspect of the thigh. This site's maximum recommended fluid volume for intramuscular injections is 3 to 5 milliliters. When we administer medications via the subcutaneous route, the medications enter the hypodermis layer, also referred to as the subcutaneous layer, which is below the dermis. Medication absorption in these sites will be slow and steady. There are 3 common sites for subcutaneous injections. These include the lateral part of the upper arm, the anterior upper thigh, and the lower abdomen, ensuring we stay at least 2 inches away from the umbilicus. We want to avoid the umbilicus and its surrounding area because it has less reliable blood flow and contains dense connective tissue, which both attribute to impaired drug absorption and causes discomfort for the patient. The gauges recommended for subcutaneous injections are 25 to 32 gauge, and a total single volume administered at once should not exceed 1.5 mL to 3 mL. Some advantages of subcutaneous injections include ease of administration for patients to self-inject. It's considered less painful because of how much thinner and shorter the needles are. There is also less risk of infections compared to IV administration. Although not as common, intradermal administration is used mostly for allergy screening, diagnostic testing, and vaccine administration. The injection is given between the epidermis and the hypodermis. It has the longest absorption time out of all the parenteral injection routes. Sites of administration include the inner surface of the forearm, the upper back below the scapula, or the deltoid. The needle gauge is typically between 25 to 27 in gauge, and the volume administered is usually 0.1 mL or less. When the injection is given, a small wheal or a bleb may form, which resembles a small blister just under the skin. The advantage to using this route is that it allows for easy visualization of a reaction when we're checking for allergies, or a positive result when we're using it for diagnostic testing. This has been your dose for medication education. I do hope you're enjoying my videos. If you do, please like and subscribe, especially give me some feedback. I really want to hear from the few people that watch my videos. Anyways, on my next video, I'll be continuing the same topic. We'll jump into pharmaceutical preparations that are used for injections. Thank you. Have a good day.